Welcome back to News 3 Today at 11. It's a time for us to prioritize our well-being, take steps towards building healthier habits, and connect with resources. May is Mental Health Awareness Month. Held every year since 1949, it aims to reduce the stigma surrounding behavioral health issues, educate the public, and highlight that mental health is essential to overall wellness. Vera Salzburn is the Director of Impact at the Mediation Center. She joins us now with more. Thank you so much for being here today.
Yes, thank you, Kim, for having me. Thank you.
Well, this is such an important topic. Recently, Governor Brian Kemp presented a proclamation, issued a proclamation declaring May Mental Health Awareness Month. And according to that document, it says that nearly 20% of children and young people in the United States report having a mental, emotional, developmental, or behavioral disorder.
That's correct. 20% of young people, as well as 1 in 5 adults, experience mental health disorders in Georgia and nationally. So there are a lot of organizations that take advantage of Mental Health Month to promote their services, to help people build awareness about the signs that individuals may exhibit when they experience those challenges. We're also here to encourage organizations to create policies that help employees to mitigate burnout and cope with anxiety and all the stresses related to work or life in general.
So I have a question about the numbers. Are the numbers high because we're seeing more incidents, or are they high because they're being reported more often?
This is a really good question. So I can give an example with suicidality and suicide prevention statistics. A lot of the times when it comes to suicide prevention, we see quite high number of reported suicides. In fact, in the United States, usually annually about 48 to 49,000 people lose their life to suicide. However, you can imagine due to stigma, due to different communities having different reporting procedures, we recognize that this is just the top of the iceberg. And the numbers that we can see through statistics a lot of the times are not accurately reflecting the totality of the problem.
So we're talking about burnout and anxiety and all of these things that we're consuming in our brains because we're doing all the things at all the times, and all of the information, especially in today's day and age, we're getting. How does that affect our bodies?
Exactly. So it's really interesting how there is this common notion that we are able to multitask as human beings. And according to brain science, multitasking is not quite what happens in the brain. We're able to respond to things quickly, but that does happen on one-to-one basis. So the more information is thrown at us, the more tasks we have to manage, the more problems we have to solve in our brain, the more energy we use, and it does affect our stress levels. And a lot of the times it can keep us in that state of activation, in that state of alertness, which can very much so lead to a burnout, fatigue, anxiety. And if a person is stuck in those patterns for a prolonged period of times, weeks and weeks, it can actually become a chronic condition.
So how do we dig ourselves out of that?
Yes, that's a good question. Sometimes we need to go to a doctor, sometimes we need to go see a therapist, we need to take medication. But on a day-to-day basis, we can build simple resiliency skills to help our brain take those micro breaks. So using your senses, for example, is one skill. It's a mindfulness skill where it's literally about stopping and smelling the roses, noticing the smells around you, noticing the colors, noticing the sounds, taking breaths, just taking breaks to take deeper breaths. That's a simple exercise, simple break. Surrounding yourself and creating an environment where you have objects that you can look at and that make you feel good or help you relax more. Think about the picture that you may have on the cover of your phone. A lot of the times, people who have a screensaver on their phone, it's their family or nature or some positive quotes. Somehow you created that resource for yourself intentionally, or maybe just not intentionally. So think about that. How can you create opportunities for your mind to go into a happier place? That's also one of the skills that we actually teach in our resiliency training.
We also have to realize that mental health and physical health go hand in hand.
They really do. So there is a very strong connection, and we know this from research, from science, between our body and our mind. So think about this. When you have ache in your body, or when you have discomfort in your body, can you truly feel relaxed and happy in that moment? Probably not. So creating opportunities for your body to relax more, exercising, eating food that energizes you and makes you feel good about yourself, that can also significantly impact our mental health. And what actually I also wanted to bring up, in 2022 in Georgia, there was a passing of the bill. It's a Parity Act that requires insurance providers to recognize mental health coverage equally with health coverage.
Yes.
So even that tells us now that on different levels of government and healthcare, there is now a recognition that mental health and health go hand in hand together.
And that's a big deal.
It's a big deal.
Yeah. So one more thing. When we talk about support, how much of it relies on connectivity?
A lot. So as human beings, we are not meant to be alone, and connection and compassion are necessary for our brain and our body have a sense of safety. And only when we truly feel safe, that's when we can integrate information, make sense of our life, cope with difficult emotions, and make healthy decisions. So healthy connections, safe connections are so incredibly important for individuals' health, family health, and community health.
All right. And Vera, how can people find out more if they'd like to tap into the resources that you provide?
Yes, thank you. So please visit our website, mediationsavannah.com. We have a Facebook page. Actually, at the end of this month, the last Thursday and Friday of this month, we are offering a free to the community suicide intervention training. If you're interested, you can register online. And we offer regular opportunities for people to learn about resiliency and mental health virtually and in person.
All right, very important information. Vera Salzberg, thank you for joining us today. And you can find more information and see this interview again with Vera on our website by going to wsav.com/community corner. Right now, it's time for a look at our forecast. Good morning, Alyssa.